Welcome back to the Tropical NurseTalk Healing with Local Wisdom podcast episode 3 with the topic between myths and medicines. Hello, I'm Grace, your host for today. We are going to talk about 3 of the most common tropical diseases in Indonesia. Our guest for this episode is Dr. Faizatur Rosyidah, M.Ked.Trop, who is a doctor and graduate as a master's degree in tropical diseases. In this episode, we'll be exploring the myths and medical treatment surrounding the 3 tropical diseases we discussed in previous episode. Alright, doctor, today we are going to dive into a fascinating topic, the myths surrounding tropical diseases, especially dengue fever, tuberculosis, and malaria. Doctor, is it true that people with dengue fever are not allowed to eat eggs?
That's a myth that is still widely believed until today. In fact, dengue fever patients actually need high-protein foods such as eggs and fish to help with platelet production and speed up the recovery process.
Interesting, doctor. What about tuberculosis? Many people still believe that TB is a curse of or a hereditary disease.
That's not true. Tuberculosis is caused by an infection of the Mycobacterium tuberculosis bacteria, which spreads through the air. It's not a curse, of course, and it's not a hereditary disease. The misconception often leads to stigma and delays in seeking proper treatment.
Okay, now doctor, here is another one that often comes up in conversation, malaria. Some people say it can be cured just by drinking coconut water or taking herbal remedies. Is that true?
That's also a myth. Malaria is caused by Plasmodium parasites and must be treated with anti-malaria agent or anti-malaria drugs such as ACT, artemisinin-based combination therapy. Meanwhile, coconut water can help with hydration, but it can't cure the disease. Herbal remedies may be used on complementary treatment, but they should never replace proper medical therapy.
Okay, what about the myths surrounding medical treatment in the community, doctor?
This is an important topic also and still widely misunderstood in many communities, including our community.
Okay, let's start with the most common one, dengue fever. Many people believe that if you have dengue, you just need to rest and drink guava juice. No need for medicine, some even take antibiotics right away. What's your take on that, doctor?
This is actually a dangerous myth because, dengue fever is caused by a virus, so it can't be treated with antibiotics. Guava juice is helpful because it's rich in vitamin C, but it's not a substitute to proper medical care. The main treatment for dengue involves maintaining proper hydration, monitoring platelet counts, and hospitalization if it is needed. Taking medication without a proper diagnosis can be risky and should be avoided.
Okay, let's move on to the tuberculosis. I often hear that TB patients stop taking their medication once the symptoms go away because they feel current. Is this dangerous, doctor?
Yes, that's extremely dangerous. TB medication must be taken for at least 6 months, following the prescribed treatment protocol. If the medication is stopped halfway, it can lead to drug resistance and the disease may come back. We call this drug-resistant TB. So, even if the coughing has stopped and the symptoms seem gone, the treatment must be completed to ensure full recovery.
Alright, lastly, let's talk about malaria. Some people say that herbal remedies or coconut water alone are enough to treat it, that anti-malarial drugs are too harsh for the body. Is that true, doctor?
That's also myth that can actually worsen the patient's condition. Malaria is an infection caused by Plasmodium parasites and can only be cured with anti-malarial drugs, as I said before, such as ACT, artemisinin-based combination therapy. Coconut water may help with hydration, and herbal remedies may be used as a complementary treatment, but they can't replace the proper medication.
Alright, so in conclusion, not everything natural is necessarily safe, and the disappearance of symptoms doesn't always mean you're cured. Is that right, doctor?
Exactly. Adhering to the prescribed medication, getting an accurate diagnosis, and avoiding myths are key to recovering from tropical diseases. Traditional remedies can be helpful as long as they don't replace the main treatment and are used under medical prescription or medical supervision.
Thank you for your explanation, Dr. Faiza. We hope our listener now better understand in the importance of proper treatment and avoid falling into harmful myths.
You're welcome.
Next, Doctor, let's talk about a common belief in many communities. The use of traditional remedies like eucalyptus oil, kerokan or scalping therapy, and herbal jamu as the main treatment for tropical diseases like dengue, TB, and malaria. What's your view on that? Okay, let's start with dengue fever, doctor. Many parents still believe that when a child has a fever due to dengue, applying eucalyptus oil and doing kerokan is enough. Some even think it's more effective than going to the doctor. What do you think about this, doctor?
That's a myth that I often encounter. Eucalyptus oil and kerokan may provide a temporary warming effect, yes, but they do not cure the illness. Dengue fever is caused by the dengue virus, and what patients really need is proper rest, hydration, platelet monitoring, and hospitalization if it is needed or necessary, not scraping theory. In fact, kerokan can even cause skin irritation or secondary infection, so it should be used with caution. The most important thing is to seek medical help early. You know that patient should be given education. The most important thing is to seek medical help early and avoid relying solely on traditional methods.
What about tuberculosis, doctor? Many people still believe that drinking bitter herbal jamu or the conscience made from roots is enough to cure TB without the need for medical drugs. And what's your response to that?
That's a major misconception. Tuberculosis is a bacterial infection that can only be cured by specific antibiotic, and this must be taken consistently for at least 6 months without interruption. Herbal jamu may help improve stamina or appetite, but it can't kill the TB bacteria. If the disease isn't treated properly, it can spread to others and may develop into drug-resistant TB, which much more difficult and expensive to treat. So, while traditional remedies might support general well-being, they must never replace the essential role of medical treatment in curing TB.
Okay, doctor, lastly, let's talk about malaria. There's a belief that drinking herbal mosquito repellents or juice coconut water is enough to cure it. Some even say anti-malaria drugs are too harsh for the body. Is that true, doctor?
That's also a myth. Malaria is, like what I said, malaria is caused by Plasmodium parasites and must be treated with anti-malarial medication such as ACT. while coconut water can help with hydration. Herbal jamu may be used, but as a complementary remedy. They are not substitutes for proper medical treatment. If malaria not treated correctly, it can lead to serious complications, including organ damage, coma, or even death. So, it's critical to get the right diagnosis and follow the proper treatment plan.
Okay, so in conclusion, traditional remedies can be beneficial, but they shouldn't be used as the main treatment, right, doctor?
Exactly. Traditional remedies can support recovery, for example, by improving stamina, easing symptoms, or aiding hydration. But they can't replace proper diagnosis and medical treatment, especially for serious tropical diseases like dengue, TB, or malaria. The key, what I want to say, is balance. We can respect local wisdom and cultural practices, but always combine the local wisdom and cultural practices with evidence-based medicine. That's why patients get the best of both worlds: healing that's safe, effective, and holistic.
Okay, doctor, one more important point. Many traditional remedies are deeply rooted in local culture and passed down through generations. How can we communicate medical facts without offending this cultural belief?
That is such an important question. As healthcare professionals, we must respect our local culture, because traditional beliefs are part of a community's identity and heritage. But at the same time, we have a responsibility to provide education based on scientific evidence. I always explain that traditional remedies are allowed as long as they are not used to replace the medical treatment, but rather as a complementary to it. For example, jamu can help maintain stamina. Eucalyptus oil may provide a sense of comfort. But for treating illness like dengue, tuberculosis, or malaria, it can't be the main treatment. Proper medical treatment is essential. By delivering this message with respect and clarity, we can help communities embrace both tradition and modern science, working together for better health outcomes.
Okay, so the approach isn't about forbidding traditional practice, but rather encouraging people to understand the different roles of each type of treatment. Is that right, doctor?
Absolutely right. The key is to invite dialogue, not pass judgment. Culture and science can go hand in hand, as long as there's open communication and mutual respect. When we listen first, then explain with empathy, people become more receptive. We are not here to erase traditions, but to build bridge so that cultural practices and scientific knowledge can work together for better health and for well-being.
Okay, thank you so much, Dr. Faiz. We hope this podcast can be useful for our listener. So, see you in the next episode. Bye-bye.